So we're going to dive into the cardiovascular system, which is chapter 10. So an overview of chapter 10 is we're going to be looking at the location of the cardiovascular reflexes, the entire cardiovascular system, the path of circulation, and then we're going to look at the conditions of the cardiovascular system. So we're going to kick this off by watching a video. Okay, so if you look at page 10.2, you're going to see that the only reflex that we have for the cardiovascular system is the heart. Again, you notice on the right foot that the heart is in zone 1, whereas on the left foot, it's in zones 1 and 2. And in reflexology, if you look at the bottom where the heel is, it says the hemorrhoid horseshoe. So we do work the hemorrhoid horseshoe. It's just a reflex that helps in the hemorrhoid area. Now on page 10.3, when you look at the cardiovascular system, you notice that there's the lungs. So the heart is the main reflex, and it pumps the blood throughout the body through arteries and veins and the femoral artery, but the lungs is where the blood has to go in order to get oxygenated. So that's why it's part of the cardiovascular system. Now on page 10.3, you're going to see the way that the blood flows. And here I have a color version of it. So deoxygenated blood is going to come in through the superior vena cava. It's going to go through the right atrium and up through the right ventricle and out the pulmonary artery. And then it's going to come, once it's oxygenated, it's going to come back in the pulmonary vein, through the left atrium, up through the left ventricle, and out the aorta. So again, the way that it flows is it's going to come in the superior vena cava, out the right atrium, into the right ventricle. So the blue is deoxygenated blood, out the pulmonary artery. It's going to go into the lungs, get oxygenated, come in through the pulmonary vein, through the left atrium, and then it's going to hop through the left ventricle and go out the aorta. All right. So on page 10.5, I want you to highlight blood, arteries. On page 10.6, I want you to highlight veins and the path of circulation. Okay. Now on page 10.7, we get into the cardiovascular system and all of the conditions that there are. So there's angina, arteriosclerosis, the blood diseases like anemia, leukemia, sickle cell disease, thrombocytopenia, thrombocytosis, Berger's disease, carditis, congenital heart defects, congestive heart failure, nosebleeds, fainting, headaches, heart attacks, heart murmurs, hemorrhoids. Again, we use the hemorrhoid horseshoe for that one. Hypertension, hypotension, peripheral vascular disease, phlebitis, Raynaud's disease, Rh factor incapability, stroke, thrombosis, thrombophlebitis, and veins. Now, there is something that is very critical to know, and in reflexology, there are two things that are contraindicated. We do not work on clients that have a stroke because we do not want them to have another stroke, and we don't work where there's blood clots because reflexology, it helps restore balance. Now, you usually want your blood to flow. You usually want increased circulation, but in this case, you do not want a blood clot to move because that can be deadly. So you'd never, ever, ever work on anybody with a blood clot or a stroke unless they have gone to the doctor and the doctor has cleared them to participate in a modality that increases circulation. You are never going to ask a client to go to the doctor and say, can I do reflexology? Most medical doctors don't think reflexology does anything, and they'll probably say yes. But what you want to do is you want your client to go to the doctor and say, is it safe to increase circulation? That is something that they're going to understand. If they say no, then there's no reflexology. If they say yes, then there is. Once a stroke patient has been deemed stable, it's okay to do a reflexology session. Just make sure that they're stable. And they have a doctor's note confirming that they can increase circulation. If they have a blood clot, most times they go on to medication to thin the blood. It's warfarin or some other medication. Once the blood is thinned and the doctor has confirmed it is safe to do a session that increases circulation, you can work on a client that has previously had a blood clot. You just can't do it when it's current. Okay? Make sense? All right. So here we're going to do a little exercise. You are going to, if you have any of the cardiovascular conditions, you are now going to put them on your treatment plan.